Hi, I'm Katrina Jarvis. This is Introduction to Substance Abuse. We are on weeks 3 and 4, where we're going over treatment plans and uh, screening tools. So I'm going to share with you my micro lecture. And these are the learning objectives. We're going to define, explore, identify how to do a screening. So, what is a screening assessment? A general overview of the process by which the counselor and client review the current situations, symptoms to determine the probability of a problem. Typically, you sit down in an office with a counselor or a clinician, and it takes 20 to 30 minutes, and you answer a questionnaire acknowledging strengths and needs, relevant history, age, and demographics. And so, for example, you might encourage a screen for mental health issues, but in this case, we're determining a screening for substance abuse. So you always want to be respectful, non-judgmental, attentive, empathize, establish that trust and rapport, motivate the client, mention how assessments are beneficial to reach life goals. It's very important that the client knows that there's no consequences to this, and it's just to help them move forward in their life and make plans and for the future. So explore and identify. This is what um, a screening looks like. And we are going to play the clinician. So I'm going to take you to I'm going to take you to a team screening tool. And we're playing the clinician. This is the BSTAD. It identifies the most commonly used substances: tobacco, alcohol, and marijuana. So this is a little information. You can find it at nida.nih.gov. It's the National Institute for Drug Abuse. And we're going to play the clinician. And I'm just going to go through and click away. Typically, you want to ask these questions to your client, like how many days in the past year did you have sips of beer, wine, or any drink containing alcohol? That would be a question you would ask your client. Marijuana, we're just gonna click, click, click. It talks about prescription stimulants, over-the-counter medications, and for the record, I am the clinician and I am pretending to be with a client. So we're clicking away and we get this nice summary at the end. And then identified tobacco, alcohol, heroin, and over-the-counter medications. It gives us all these nice references and resources, and suggested clinical action. So how to best manage care going forward with this individual. So you might want to provide feedback, facilitate goal setting, ask the parents if they know about substance abuse, and ask permission. Always ask permission. Discuss a referral and arrange a follow-up. So a screening tool is essentially the first step of the building blocks to treatment. And I'm going to take you back to my micro lecture. Not trying to give you a headache here. um, so yeah, we know how to use the screening tool now, or briefly. Next steps would be treatment approaches, a treatment plan, question to involve family or therapy, medication assisted treatment, interventions, goals and plans, and plenty of resources. So there's so many places you can read up on this, and I hope I was helpful in some way. And thank you so much for listening.